Hello there, my name is Kelly Diaz. I'm one of the occupational therapists here at the Baptist Orthopedic Hospital. I've been occupational therapist for 10 years. This video will consist of me and a physical therapist telling you about everything that you need to know before going home after your total knee and total hip replacement. After your joint replacement, you have some precautions. These are movements that you want to avoid that could potentially hurt you or your surgery. For hip surgeries, we tell you to not go past a stretch. So when you're walking, getting out of bed, or bending over to reach your lower body, keep the movements small. After your knee replacement, you have 3 precautions. The first is no pillow under the knee. Avoid putting any pillow under the knee for about 2 months. This way you reduce your risk of developing any scar tissue in the bent position. We need that knee straight for you to walk without a limp. The second precaution is no twisting. The only way we want you to bend your knee is back and forth. Avoid bringing your foot up to your lap. That is twisting, and we do not want you to do that. That'll be for 2 months. Your third precaution is no kneeling on that knee. For 2 months, I don't want you to kneel at all. After that, you can kneel, but you're going to kneel in a different way. You're going to float your knee. That means when you kneel, most of the pressure is going to be through your shin and not through your kneecap. Instead of all the pressure going through your knee, you're going to get a pillow or cushion and kneel with all the pressure going through your shin. This is how you're going to be kneeling from now on. We want that knee to last a long time. You need to take care of it. For your showers after a total hip or total knee replacement, we recommend that you sit in the shower for approximately a month. We also recommend a dry transfer, meaning you want to sit down before you turn the water on, and when you're done, dry off before you get out. This will help avoid the risk of falling on a slippery surface. If you have a tub shower like this, we recommend a transfer tub bench. 2 legs are outside of the tub, the rest of the legs are inside, so that with your walker, you walk up to the chair, have a seat, and swing your legs over and slide over. This will help avoid for knee replacements bending your knee over 100 degrees, and for hip and knee replacements putting all your weight on that surgery leg, which isn't safe. To avoid water running out onto your floor, I recommend that you get a shower curtain liner, and you're going to cut a square out of the liner so that when you pull the curtain, it holds all the water in and water doesn't run out onto your floor. Now we're going to demonstrate a transfer. What the patient is going to do is walk all the way up to the bench with the walker. Turn around so that you can back up to the bench. You're going to back up until you feel the back of your legs at the chair. Then reach back for the bench and have a seat. You'll want to move the walker out of the way, and then you're going to swing your legs over and slide back into the tub. Your curtain is already cut, so you're just going to pull that and place the curtain over the chair so that water does not run out into the shower. Now you can turn on the water. Remember, always do a dry transfer. If you have a shower stall like this one, you're going to be sitting on the 3-in-1 commode chair, or you're always welcome to purchase a shower chair on your own separately. You're going to take the walker and with a shower stall, bring the walker all the way to the lip, as close as you can. You're going to step up into the shower with your non-surgery or stronger foot, like so. Bring your surgery leg back, and now you can safely sit down. When you're done, your walker is going to be right in place, and you're going to step down with your surgery leg. That way your arms can support you as you step down. The rule here is up with your good foot, down with your bad foot. If you have a shower that is big enough for you to take your walker, that's what you want to do. You want to avoid the time that you're out of the walker for safety. If you have a lip to go over, you'll walk up to that lip as close as you can, bring the walker over the lip, and the same rule applies. Up with your good foot, down with your bad foot. Walk to your chair, and then have a seat. Have somebody take the walker out for you. When you're done, have somebody bring you the walker back and walk out. If you have a sunken shower, the same rule applies. It would just be opposite. Remember, up with your good foot, down with your bad foot. The hip kit is a set of 4 pieces of equipment to help you with dressing and bathing your lower body. The hip kit we offer through the hospital includes a reacher, a long-handled shoehorn, a sock aid, and a long-handled sponge. You're welcome to purchase these online at most pharmacies, drugstores, or medical supply companies. To take off shoes and socks, you want to use the reacher. On the end of the reacher is a peg, and you're going to go down to your heel, and with the peg, you're going to push off your shoe, and then you would also push off your sock. To get on shorts, underwear, pants, whatever you want to feed over, instead of bending over to break your hip precautions or bending your knee, you're going to use the reacher. You're going to dress your surgery leg first. So grab a hold of whatever you're feeding over your foot, and with the reacher, hold onto the waistline and dress your surgery leg first, bringing it over your foot until you can reach it. If there's nothing wrong with the other leg, you can simply bend that knee or that hip. If you need an extended reach, then you can do the same thing with the other side, bringing it over that foot. Once it's to your knees, you stand up and finish the job. Now for socks. This is a sock aid. The open part goes up. Your foot is going to slide in like so. However you put the sock on the sock aid is how it's going to go on your foot. So you want to make sure that it's oriented the right way. You don't leave any material hanging off, and it's not folded over, because that'll be how it is on your foot. So with the sock, you're going to feed it over the sock aid all the way until it's flush. And I want to make sure that it's not twisted or folded. Now you get to go fishing. You're going to cast your line, put your foot in, point your toe down, and you're going to pull until the sock aid comes off. You'll get really good at this, but if you need to adjust the sock, you can use the reacher to do that. Any way you need to. To take the sock off, again, go to the back of the heel, and with the peg, you're going to push the sock right off. For shoes, you are going to use the reacher and the long-handled shoehorn at the same time. With the reacher, you're going to hold on to the tongue. With the shoehorn, you're going to put that in at the same time. That way you can avoid the heel bending over and then fighting with that later. You're going to place this over your toe and then pick up your leg one time to get your heel on the back of that shoehorn, and then it slides right in. I recommend elastic shoelaces if you wear a lot of tennis shoes or lace-up shoes. Elastic shoelaces you can find at Academy, Walgreens, any shoe company, or online. You lace up the shoes, tie them, and leave them tied. But because they give, you can use them as slip-ons. This is a long-handled sponge. This is just to bathe your lower body to avoid bending over. For hip replacements, anticipate using this equipment for approximately a month. For knee replacements, if you needed help before surgery, this might be beneficial to you. Most knee patients by next week won't need this. If you have a Meplex bandage, you'll need to cover that in the shower. As you bend and move your new joint, spaces can develop where water can seep in. So you want to cover your bandage as long as you have it on. How you're going to do that is with plastic and waterproof tape. You're going to take the plastic, whatever you have at home, saran wrap, a Ziploc bag, press and seal. And with plastic waterproof tape, you're going to tape it to your leg. Like so. 10 to 14 days after you leave the hospital, you'll have a follow-up with your surgeon. At that time, he's going to take off the bandage and see what your incision looks like. He'll probably tell you that you don't have to cover it anymore. Until that time, you'll want to cover this as long as you're taking a shower. You will be using your rolling walker for approximately a month, give or take a week or two. To use the rocker safely, you always need to have 2 hands on the walker. The rule is 2 hands or no hands. If I put just a little bit of weight through only one side, the walker becomes very unstable and we don't want you to fall. If you need to carry something, get a backpack, tie a bag on the front. You can put it on the side. You're welcome to get a tray or a basket or a cup holder, whatever keeps both hands on this walker. If you're going to reach for something in and around your house, I want you to use a counter to support yourself. If you're working at the counter level or above, you're going to go right up to the counter, staying in the walker. That way, one hand can be on the counter and you can reach for whatever you need to do. If you need to get a cup out of the cupboard, if you need to brush your teeth or wash your hands, whatever you need to do above the counter, use one hand on the counter. If you're working with a space below the counter or a refrigerator that you have to get out of the way of the door of, you're going to come at it from the side. So if it's the oven, the dishwasher, or the refrigerator, don't back up until the door opens and risk a fall by leaning and reaching with only one hand on the walker. Instead, come at it from the side, put your hand on the counter, and then the door will open and you'll be able to reach safely. If you're getting something out of the refrigerator, you go right up to the refrigerator. If there's not a counter here, then just hold on to the refrigerator itself. That way you can reach safely. You want to make your home as user-friendly and safe as possible. Remember, you'll be using the walker for about a month, so make sure that all the throw rugs that you have are rolled up and put them away. People trip on throw rugs all the time with just 2 feet, 2 good feet, and now you have a surgery leg and 4 extra feet to worry about. This walker has to get in and around your bathroom and your kitchen and your hallway, so make sure that anything that you have in the way, any obstacles, are cleared out.